Hello, I'm Dr. Chris Marshall here at Medical Specialty Clinic. I appreciate you tuning in for this video. Today I would like to talk a little bit about melatonin. Melatonin is a natural hormone that the body makes. It's actually made in the brain, in the pineal gland. Melatonin helps us coordinate our circadian rhythm. So that's our rhythm where we are typically awake during the day and then at night we go to sleep. So melatonin helps us coordinate that. Melatonin levels typically rise at night when the sun goes down or it gets dark. Then they drop rather quickly when we get exposed to light. Now, it can be sunlight or artificial light. That helps us keep a normal rhythm where we wake up in the morning and then we typically get tired and go to sleep at night. That can be a problem for some people when they work at night. They have what we call shift work disorder. So melatonin can help with that. You can take some melatonin normally when you're trying to go to sleep and it's during the day, and then you can take some melatonin and that can help. So just a little disclaimer before we get too far into the video, always discuss any medication changes or taking any supplements with your primary care provider before you start taking them, because it can be safe or unsafe depending on the situation. Melatonin in general, considered very safe. It can have some side effects, but it's typically very well tolerated. So some of the side effects that you can have from melatonin would be headaches and some dizziness, nausea, that kind of thing. But again, most people do not have any trouble with melatonin. It's safe for kids to take. But again, anytime you have a question about it, always discuss it with your healthcare provider before you start any supplements. So why would someone want to take melatonin? Well, it can have several benefits. The first is obviously to help you sleep, since that's what our bodies typically make it at night to help us get in the routine of going to sleep. Melatonin can be pretty useful when people have difficulty sleeping. If you have trouble getting to sleep, then melatonin can help. So you'd want to take typically 1 to 3 milligrams would be a good place to start. Some people can start with a half of a milligram if they're real sensitive to it, but usually 1 to 3 milligrams is fine. And then you could try that dose for 2 or 3 nights in a row. If that didn't work, then you could increase it. And again, very safe. I have seen people take 50 and even 100 milligrams of melatonin at night. Now, typically you do not need that much to help with sleep. Start low and increase slowly if it doesn't help, or if you start having side effects, then you could back down on the dose. One brand that we sell here at the office is made by Nutrascriptives, and it's actually a sustained release, so it lasts a little bit longer. So melatonin has a fairly short half-life, meaning it doesn't last very long in the body. So the sustained release kind of helps it stay with you. So if you have a little more trouble maybe staying asleep, then the sustained release formula might be a little bit better for you. But if it's just trouble getting to sleep, then the immediate release or the regular melatonin would be fine. We carry the Nutrascriptives brand because I think it's a good quality product. There are several products on the market. Well, thousands probably of melatonin products on the market, and some studies they've done have shown that they may not actually have the amount of melatonin that they say on the label, things like that. So I'd always recommend that you get your melatonin from a reputable brand. And again, that's hard to figure out. That doesn't necessarily mean it's the most expensive brand, but try to get one from a reputable brand that you can trust. So that was melatonin to help you sleep. Then there's actually some other benefits that have been reported in the scientific literature. The studies are mixed in a lot of these cases, but some studies have shown that there was a benefit actually with decreasing cancer growth. So melatonin might be beneficial to help with cancer, slowing it down or preventing it. Another benefit is melatonin is an antioxidant, so it can help with inflammation and decreasing free radicals and things like that. So it can be very, very beneficial for that. And that is one of the reasons that some studies may have shown that it can help protect you from having coronary artery disease and strokes, things like that, vascular disease. So it can be cardioprotective. And so that is a really good benefit from it. So that's just a little bit about melatonin, how it works, and some reasons that you might want to try taking it. Again, if you have any questions about it, please discuss it further with your healthcare provider. If you're interested in buying some melatonin, we sell it here. You can come in. You don't have to have an appointment. You can just come in and ask for it. We can sell you a bottle of melatonin. It's reasonably priced and it's a good product. And also, if you want to make an appointment to come in and discuss melatonin and see if it's right for you, you can come in and see myself or one of the other providers here at Medical Specialty Clinic. Thanks for tuning into the video. Look forward to seeing you in the next one.